Having a happy, healthy child is something that every parent strives for, but many children struggle with nighttime bedwetting. Joining us today to discuss is Dr. Benjamin Rhee, who is the Chief of Pediatric Urology here at Orlando Health, Arnold Palmer Hospital for Children. Thanks so much for being here with us today.
Thank you for having me.
Potty training, nighttime bedwetting, it's something that's very unique to each child. They're ready for it at different stages. At what point does the bedwetting part of it become a concern? At what age do you start thinking, maybe there's something else going on here?
We see kids all throughout the ages, but usually until they're about 7 or 8, we don't usually make a big deal about it. The issues with bedwetting is that no one really understands why that occurs. A lot of it has to do with sleep pattern issues, how deep they're sleeping and so forth. But a lot of it also has to do with kids that are what we call pelvic floor dysfunction, where they're not peeing normally throughout the day.
Is that just something they develop because of their habits or who they are, or?
It's a learned behavior. Kids are very busy these days, and what they do is they're too busy to go to the bathroom. So once they get potty trained, they realize if they hold it longer, they can play longer. And so they get in this bad habit of holding their pee. So a lot of parents come in and say, listen, we want to talk about bedwetting, and I direct them to, hey, let's talk about daytime issues. And when you truly ask them, say, hey, listen, what happens during the day? And they go, oh, they don't really have a problem until you really dig down deep and say, are they holding? Are they running to the bathroom? Are they holding their poop as well? And they're constipated. So if you treat the daytime issues, their nighttime gets better as well.
If someone were to bring a 10 or 11, 12-year-old to you and they're still having issues with bedwetting, what are the things that you start to look for?
When your body goes to sleep, your brain releases hormones to slow down the kidneys, as well as your heart, all the structures inside your body. Kids that are very heavy sleepers, what they find is that when they do research, that they don't release that hormone, or they don't release enough of that hormone. So there are artificial hormones that we can provide for children. Usually we don't like to do that until they're older, because we don't want to start an 8-year-old and have that child be on this medication for 4 or 5 years. So usually around 10, 11, and that usually is when they start to socialize and have sleepovers, or they have sports camps. So some parents will say, listen, I don't want my child to be on this medication all the time, but we want to try it to make sure it works. And then if they're going to sports camp, or they're having a sleepover at somebody's house, they can provide that child with a medication, so they're confident they're not going to wet at somebody's house or at sports camp.
And if you would like more information, you can visit arnoldpalmerhospital.com/kidsurology.